So mood changes are very, very common in perimenopause and menopause, but as with everything, we need to keep our lens wide and make sure that it's not some other cause. So this is another thing that I think lends itself so well to the direct care model, because we can really sit and talk about this. So from a medical perspective, women who have a history of major depressive disorder, generalized anxiety, postpartum anxiety or depression, or just have felt anxious their whole life, they are at much higher risk of seeing a worsening of that as they traverse the menopause transition. For people who don't have a history of those things, what feels nearly universal is the sensation of increased irritability, impatience, shorter fuse, easy overwhelm, decreased resilience, feeling like I've always had 100 balls in the air and now I'm dropping them left and right and it's really stressing me out, and what do I do? I'm not myself. I am not performing the way I used to. That is a common experience, and sometimes something like hormone therapy can sort of make it feel like you're bringing the ground back up underneath you, which is beneficial. If there is a truly disruptive, depressive, or anxiety component, then treating that, whether it's with hormone therapy or with an antidepressant or an anti-anxiety medication, can be useful. But again, having a relationship with a doctor or a provider, whether it's me, whether it's a mental health provider, a coach, whomever, to really talk about what it means to be a woman or a person in midlife and have all these balls in the air. Maybe we're not meant to have so many balls in the air. Maybe we should let some of those balls fall and be okay with it. This is a time where we should start setting boundaries if we haven't, start saying no if that's not something that we've been good at, and really start centering ourselves in our own life. That can work wonders for how people start to feel in this time of life.